Parents have been advised to take critical look at their children's behavioral attitude during the formative years before they attain the age of 6 years. This will enable them to detect any form of deformity or medical disorder that can retard the child's growth. Physical challenge requiring special need, such as autism spectrum disorder, can be detected early. This informs the autism work to create awareness on the disorder and its management. Ken Egbelue has details.
Autism, experts say, is a neurological developmental disorder that is characterized by impaired communication and language skills, social interaction difficulties, repetition and stereotypic behavior. Doctors say there is no proven cause of autism. However, research has shown that it is connected to genetic and environmental factors. There is also no known cure for the disorder. Doctors explain that it is treatable and can be managed. The work, therefore, was to create awareness of autism and the intervention required by the affected family for its management.
At a very early age, they've decided devising means by which they can test the child's eye movements, the child's responses to interaction from parents or from the therapist, and they can tell whether this child will go on to develop autism.
The work, which started in Ikoyi with many participants working along to Lekki area.
People should be a bit more understanding of the condition of children with the condition, even adults with the condition,
where we can get help, where we can help our children to get the best in terms of helping them to integrate society, and also at the same time helping society to understand them, that it's not because they can do things differently that means that they're any lesser than they're just children. Even the adults also are just adults trying to find their own way, like you and I trying to find their way in the society they live in.
The work for autism was organized by the TLC School Center and concerned parents in Lagos. Ken Egbeluge, NTA News.
Still talking autism, I have with me in the studio an applied behavioral analyst and a parent. She's Mrs. Bolanle Adewole. She will be shedding more light on the management of the disorder. Mrs. Adewole, it's nice to see you in the studio.
Thank you for having me.
All right, so what is autism?
Autism is a neurological brain disorder that manifests as a triad of disorders. These would include lack of speech and communication, limited social skills, as well as repetitive and stereotypic behavior. What you'll see as characteristics of autism are lack of eye contact, walking on tippy-toe, not sharing empathy, not smiling, not behaving appropriately in public. That's what you'll find. But it's a faceless disorder. It's not a physical disorder.
Really? Okay, so what kind of attitude can prompt a parent to suspect that a child have autism apart from those you just mentioned?
Well, first thing will be your child not making eye contact. If you have a little baby that's not smiling at you, you try talking to your baby looks the other way, or you try engaging your baby in funny things and your baby is not smiling, not laughing. Those are areas for concern. And if your baby is fixated on certain things like the fan, the oscillation of the fan, or on lights, you just find that your child is focusing on those things only and not trying to interact with the world from a very young age, from as early as 6 months. Once they're not smiling or making eye contact, then it's a red flag. It's already something for concern. At that point, we say start to look out or start to do things that would prevent, if it can be prevented at that point. But what you want to do is you want to carry on with the child and engage the child in as many activities as possible so that the child can at least overcome it, or at least get to a point where the child can then live to optimal potential as they grow up.
All right, so are there known causes?
At the moment, no. There's no known cause. There's nothing that has been proven. But it is stated that it is related to genetic and environmental factors, but there's no proven cause for autism as we speak. The research goes on worldwide, but there's no proven cause.
What about symptoms?
Symptoms will be what I shared with you earlier. It'll basically just be them not playing. And then for the younger ones, first and foremost, they're the babies that I mentioned earlier. Then we have the toddlers who start school. It's normally detected first by either the parents or the teachers. More the teachers, because the teachers, especially for first parents may not know. They may just think it's some normal behavior. But once the child starts school from an early age, the teachers immediately pick it up or pick up on it, or should pick up on it if it's a good school where they're exposed. Because once they start to interact with the child, they notice that the child is different from the others. You notice that the child likes to keep to himself. It's not playing with other children. When you speak to the child doesn't listen, or doesn't appear to listen, doesn't respond. The child would always do something contrary to what everybody else is doing. The child can be hyperactive. So when you have a child who appears that way and who doesn't appear to be learning like everybody else, it's already a cause for concern. So at that point, immediately, the teacher in a good school should inform the administrator, who then invites the parents in and tells them there's something not quite right, and then advise them to get a diagnosis for the child.
So how prevalent is this disorder?
More and more. It's more prevalent, as we've come to see in the recent times. In the past, it used to be, I think about a couple of years ago, it was 1 in 99, and then it became 1 in 88. At this year, as I speak, in this year, it's 1 in 68 children in the United States are reported to have autism or to be on the spectrum. In Nigeria, unfortunately, we do not have any proven statistics. We do not have the research-based statistics, but we know that it exists, and we're seeing more and more of them in the educational field these days.
Okay, so what is the level of awareness in Nigeria? Are parents aware? Are teachers aware?
Some parents are aware and some teachers are aware, but if you ask me on a scale of 1 to 10, I'll say about 3 or max 4, where we still have a greater part of people in Nigeria are not aware of autism. At the walk on Saturday, people that we met on the road, I would stop them to say, do you know what autism is? And most of them kept telling me no. And this was in the highbrow area of Lagos, where you would expect that people are exposed and have information about what autism is. So really and truly, yes, we've been there trying to create awareness. Many more centers are coming up and creating awareness, but it's still not enough. We need the government to also intervene and the government to take charge and be able to propel awareness for us, so that we get to a place where we're then satisfied that we have enough. But at this point in time, I do not think we have enough awareness in Nigeria.
All right, so how do we manage children and adults with this disorder?
With autism, the way to manage them is, first you have to get them screened and diagnosed. And once they've been screened and diagnosed, it's very important that you get intervention. Intervention varies. It differs from child to child. There's something called the Individual Educational Plan. That's the IEP. That's the first. After this screening and diagnosis, you then develop an IEP for the child. And the IEP is a special plan. It's individualized. No two children can use one plan. It is one plan per child. So it's designed, tailored to the child's specific needs. So once the IEP is in place, the IEP is then what you begin to work with as an educator or as a therapist who works with them. So you start to work with the child based on the IEP, and you're bringing in speech therapy, occupational therapy, there's floor time, there's applied behavior analysis, there is physical therapy, there is language therapy, there's so many therapies, but it would depend on the child's specific needs. You don't just use all the forms of therapies that exist on one child. You need to know what that specific child needs and requires to help the child come out. So at TLP Center, that's what we focus on. We're constantly giving them the attention, and then we change the IEP every 3 months as well. Not that we change it, we modify it based on what's working, because we have a goal every 3 months on the IEP, and then we hope to achieve them. If we have not achieved them in 3 months, then we know that it's time to change something. We tweak something, because our ultimate goal is to get the children to a certain level, because we have come to identify that they can be highly functional. A good number of them have high skills, but it depends on what you put in. If you believe they can't achieve and you just don't do anything about them, then they remain there. But for those that you provide intervention at a very early stage too, you find that the outcomes are really positive. There's a high probability of them living to their full potential and doing things like everybody else.
All right, just a quick one. How do you handle integration?
Integration is quite easy for us, because we also have a school, the Learning Place. So for us at the TLP Center, once we have gotten them to a point because part of the goals on the IEP will be getting them to a point where they can now go into school for inclusion. So once they've reached that stage, we start out small. We don't do an immediate 5 days attendance at school. We start off with 2 days because we don't want to give them a ratio strain.
Okay.
So we start out going to school for 2 days, and then it increases to 3 days, and then 4 days, and before you know it, they're attending 5 days full-time like everybody else. But it's a gradual process because you want to take it slowly so that they don't have a rude shock, and you don't want them to break down or resent the transition altogether. So we do it in stages, and we break it up for them.
Okay, just a quick one again.
Yes,
Sorry.
that's okay.
So what advice do you have for parents who hide these children at home, just in few words?
They shouldn't. There's nothing to hide, especially not this day and age. If you hide them at home, you're ruining them, you're ruining yourself.
Okay.
If you bring them out, there's so much they can do. Like I said, there's a lot of potential. Most companies are now now employing them. Microsoft just recently launched an employment program for people with autism. Auticon in Berlin, Germany also did the same a couple of years ago. So if you keep them at home, you're not able to bring out the best in them. But if you bring them out, then people help you bring out the best in them, and that way they're able to be functional and they're able to be a use to the society and to the community.
All right, Mrs. Bolanle Adewale, thank you so much.
You're welcome.
Thank
you for having me.
Still to come, pupils and teachers back to school as customers' revenue drive commended. Join us again.
Start time.